think there is some issue with the A, pseudo Parkinsonism. This is the second and third of your extrapyramidal side effect. So here it is tremors. There are tremors. There is bradykinesia, or we can say bradykinesia and bradyphrenia. All right. Then the third is salivation. Okay, so in the tremors or rigidity is present. In the bradykinesia is the decrease in the facial expression. It has flat monotone voice and slow body movement, which inability to initiate any movement. So there are four things in bradykinesia. There is decreased facial expression. So there is decreased facial expression, a flat monotone voice, slow body movement, okay, and there is inability to initiate the movement. In the bradyphrenia, it is the slowed thinking. So these are the main things of the pseudo Parkinsonism. It can be mistaken with the depression. Mistaken for depression, okay, or the negative symptom of schizophrenia. Negative symptom of the schizophrenia. So what is the rating scale? This is important. The rating scale is Simpson-Angus EPS rating scale. Simpson-Angus Extrapyramidal Syndrome rating scale. The prevalence is 20%, present in elderly female. The time to develop is days to week, okay, and the treatment basically prescribe an anticholinergic and reduce the antipsychotic dose, change to an antipsychotic dose, a drug which have less pseudo Parkinson's, right? So these are the treatment of pseudo Parkinsonism. So it is basically that the clinical features are the tremors, rigidity, bradykinesia, bradyphrenia, there is salivation, okay, you can mistake with the depression or the negative symptom of schizophrenia. The rating scale is Simpson-Angus extrapyramidal scale. The prevalence is 20% in elderly female. The time is days to week. The treatment is anticholinergic drugs as discussed before in the dystonia. Then the next is your akathisia. It is the most common one. The restlessness. So what kind of restlessness? Like inner restlessness. अंदर से लगेगा, ठीक है? So it is inner restlessness where there is strong desire or compulsion to move. So patient starts moving. There is foot stamping when seated. There is constantly crossing or uncrossing of leg. There is rocking from foot to foot. Next, constantly pacing up and down. Okay? Now, akathisia can be mistaken for psychotic agitation and has been linked with suicide and aggression towards other. Okay, so the measuring scale is Barnes akathisia scale. The name is there, akathisia in there, right? Barnes akathisia scale. And very important, the prevalence is the 25%. It is a 25% prevalence, and it is less with the atypical ones, less with the atypical one. So in decreasing order, if you say which drugs causing this, so epiprazole, sorry, risperidone, olanzapine, then quetiapine, clozapine. Okay, so aripiprazole, A for A, we can learn for like that. Aripiprazole, most common cause of akathisia. So it is a potent MCQ. The next is the R for Rajiv, yes. So risperidone, okay, don't forget this. Akathisia, again, it will take hours to weeks to develop, okay. And the drug of choice, the treatment of choice is propranolol. It's a very important MCQ. Propranolol is used in the tardive dyskinesia 30 to 80 milligram per day, along with clonazepam, a 5-HT2 antagonist like cyproheptadine, mirtazapine, trazodone, mianserin. Okay, so it is very, very important. Cyproheptadine, yes, it will help a lot. Clonazepam is there, and propranolol is there. Okay, so this is all about akathisia. Akathisia basically is restlessness. This is called inner restlessness. Okay, there is foot stamping, constantly crossing and uncrossing of leg. Then there is, we say rocking from foot to foot. Now constantly pacing up and down. This is the clinical features. It mimics like a psychotic agitation or a suicide or aggression towards other tendency. The scale is the Barnes akathisia scale. The name consists of akathisia, so it will not be asked. The symptoms was pseudo Parkinson was like very important for you. The drugs severity, epiprazole most common, risperidone, then olanzapine, quetiapine, and clozapine. It may take hours to weeks to develop. The drug of choice is propranolol, and it is a very, very important question. Very, very important question. What is the treatment of choice of akathisia? It is a beta blocker, propranolol. So the uses of beta blocker में propranolol में, this is one of the most important question. Okay, now let's discuss the last one. This is tardive dyskinesia, the abnormal movement, the tardive dyskinesia. In the tardive dyskinesia, it is a late manifestation. It will take months to year to develop. Okay, now very, very important clinical feature is lip smacking. It will make this kind of sound, or chewing. There is no chewing gum, but the patient is chewing. Okay, there is orofacial movement, which can lead to difficulty in speaking, eating, or even breathing. When under stress, it increases. The movements actually worsen. Okay, the movement actually worsen. What are the other things which can be seen? Tongue protrusion. So this is trying to catch a fly catching. So tongue protrusion. Okay, like a fly catching. Then there is choreiform hand movement. It may be pill rolling, like in Parkinson. It may be pill rolling, or piano playing. Okay, so these are the clinical features of tardive dyskinesia. The scale to be measured is the abnormal involuntary movement scale. Okay, the 5%, the prevalence is the 5%, that is the lowest among all the patients because it occurs late. The 5% of patient per year in the antipsychotic exposure. Okay, elderly women, and those with the affective illness, like BPD type illness, it has a common tendency to develop. Okay, so the time taken again, it's months to year. Okay, and the treatment is clozapine. So the treatment is clozapine. It is a 2019 MCQ. It has been asked. Okay, so this is the most important antipsychotic to be associated with the resolution of the symptoms. The other drugs, very important, tetrabenzene, tetrabenzene, then ginkgo biloba. Okay, so this is all about tardive dyskinesia. It's a very important question. It will take manifestation late, lip smacking, orofacial movement. It may have a chewing, or they have difficulty in breathing, eating, breathing, and speaking. When under stress, it increases. So stress, it increases. There is tongue protrusion, a fly catching approach, coriform hand movement like a pill rolling or a piano playing. Okay, and there is abnormal involuntary movement scale, which is used to measure it, the rating scale. There is 5% of the patient have, the elderly women have the extrapyramidal side effect very commonly. It is also associated with the BPD, bipolar disorder patient. The time to develop is months to year. The treatment is clozapine, tetrabenzene, and ginkgo biloba. So let's summarize it once, very short. Let's summarize. Okay, so we'll write dystonia. Okay, we'll write pseudo Parkinsonism, we write akathisia, we write tardive dyskinesia. So basically here we have discussed about oculogyric crisis, all the important point, torticollis, okay, unable to swallow, painful, frightening. Okay, in the pseudo Parkinson there are tremors. Okay, there is salivation, there is bradykinesia and bradyphrenia. Phrenia means slowed thinking. Okay, these are very common. Akathisia, it is inner restlessness. What we'll see, foot stamping, crossing, uncrossing of leg. Okay, rocking from foot to foot, pacing up and down. In the tardive dyskinesia there is lip smacking, chewing, coriform hand movement. Okay, there is also something called pelvic thrusting. Okay, these are the four. Now these are the clinical feature. Now here comes your rail scales. There is no specific scale. It is the general EPS scale. In the dystonia part, here comes the pseudo Parkinsonism, here comes the akathisia, here comes the TD. Okay, so scale is the Simpson Angus scale, Angus EPS scale. It is the Barnes akathisia scale. It is the abnormal involuntary movement scale, also known as AIMS, abnormal involuntary movement scale. Okay, then comes the prevalence. It is 10% young male, it is 20% elderly female, again 5% elderly female, and 25% highest prevalence. ठीक है, the dosing aripiprazole A for A. This is what we have discussed in the prevalence one. The time to develop, it is within hours or within minutes. ठीक है, very common. Then days to weeks, then hours to weeks, months to years. Okay, so dystonia is within minutes. It's an important MCQ. Then treatment. This is injection phenargan promethazine. Anticholinergics can be used here. Anticholinergic used here. Here the dose is propranolol, beta blocker. Here is clozapine. And also clozapine, then tetrabenazine or ginkgo biloba, GB. Okay, so this is all about summary of extrapyramidal side effect. I want you to make this particular table and just stick it out somewhere. This is a very important table, and this will have at least 2 to 3 MCQ in every year in any exam all over, whatever you want to give. So okay, so this is end for EPS. Signing off.